Good day, and welcome to our celebration honoring Black Maternal Health Week. I'm Melvette Hill, the Executive Director of the Commission on Women, Children, Seniors, Equity, and Opportunity, and I'm honored to be here today with you. Black Maternal Health Week was founded by the Black Mamas Matters Alliance to amplify the voices of Black mothers and birthing people. This week serves as both a celebration of the resilience and strength of Black families and an urgent call to action to address the maternal health crisis that disproportionately affects Black women in our country and here in Connecticut. The statistics are sobering. Black women are 3 to 4 times more likely to die from pregnancy-related complications than white women. But behind every statistic is a mother, a family, a community that deserves better. This is why our work at the Commission intersects so powerfully with maternal health, because equity isn't just a goal, it's a necessity for survival. And so here in Connecticut, we're taking meaningful action. Our state has already passed groundbreaking legislation, including the extension of Medicaid coverage for postpartum care for a full year, ensuring that mothers don't lose critical health coverage when they need it most. But we have a lot of work to do, and policy alone isn't enough. True change happens at the intersection of joy and justice, when we celebrate Black motherhood while simultaneously dismantling the systems that create disparities. So today's conversation will explore how we can hold both the celebration of Black maternal strength and the urgent work of justice that our communities deserve. So thank you for tuning in to this webinar. Let's move forward together with both purpose and hope. Now it's my honor to introduce Jameson C. Davis, our legislative policy analyst working on policy issues affecting African Americans and those in the African diaspora. Jameson?
Thank you, Melvette. Hello and welcome. Thank you all so much for being here today. It truly means a lot to welcome so many community members, advocates, legislators, taking the time to engage in this important conversation. My name is Jameson Christopher, and I serve as the African American Legislative Policy Analyst with the Commission on Women, Children, Seniors, Equity, and Opportunity. It is both an honor and a responsibility to help convene spaces like this, spaces where we can listen, learn, reflect, and move toward meaningful change together. Today, we gather in recognition of Black Maternal Health Week, a national observance held each year from April 11th to the 17th. This week is about more than awareness. It's about uplifting voices, experiences, and leadership of Black mothers, Black families, and the birth workers who support them. It is about acknowledging the deep and ongoing disparities that exist in maternal health outcomes and committing ourselves to solutions that are rooted in equity, dignity, and care. But just as importantly, this week is about joy. It is about honoring the beauty, the strength, and the resilience of Black motherhood. It is about creating space, not only to name the challenges, but to celebrate the love, the community, and the cultural traditions that continue to sustain Black families across generations. And for me, this conversation is personal. As an unapologetic Black man and expecting father who witnesses firsthand the strength of my queen, I'm thinking every day about what it means to bring a child into this world. I'm thinking about the healthcare accessibility for my partner. I'm thinking about the systems that will shape my child's life, the care that my family will receive, and the kind of future we are building, not just for our child, but for all families. This is not abstract. This is real. This is about partners, our children, our communities. It is about ensuring that Black mothers are not only safe, but seen, heard, respected, and supported at every stage of this journey. It's about recognizing that solutions already exist in our community, already, through the works of doulas, midwives, and Black-led organizations who have long been on the front lines of care, advocacy, and healing. So today, as we move through this program, I invite us all to be present, to listen deeply, reflect honestly, and to think boldly about the role each of us can play. whether as a policymaker, a practitioner, or a community member, in advancing a future where Black maternal health is truly rooted in justice and joy. Thank you for being here, and I greatly appreciate your time. So with that, let's begin. As we move from welcome into intention, we invite you to settle in. Open your hearts for a powerful offering as you center the voices and experiences that bring us here today. Transitioning into our open mic segment, Letters to Mothers, Ancestors, and Future Children, narrated by Shamica Frasier, founder and lead doula at New Birth Journey. Shamica?
Hey. Hi, so the first poem, the first letter I'm going to read is by Lauríel Rivera-Stone, our own home birth midwife here. So, La Gran Madre, La Madre Sagrada, La Madre Universal, tú lo ves, mira que bella está eso. Look at the way earth blooms, flowers opening without force, without question. Fully expressed and feminine, that is you, that is us. Sacred creation unfolding in its own time, in her own time. To my mother, I thank you. To her mother, I thank you. And to all the mothers before them, I thank you. I carry you. I move with you. You live in me. It is one of my deepest honors. May we, your daughters, always be an expression of all you held your joy, your sacrifice, your silence. May we give voice to what you couldn't name. May we be a continuation of your miraculous creations. May healing move through us back to you and forward for all the mothers to benefit. To the mothers, coming we see you, we honor you. To myself, as future madre, I cannot wait to meet you, to witness your expansiveness, sacred walk, and may the path I walk as a midwife always remember you, always make space for you, always hold you. We love you. We honor you. Te adoramos. I and my sisters bow to the mother in all forms. With reverence y con mucho amor, Lauríel y tus hijas. So I will continue on to the next letter, which is by me. Dear Nana, thank you. You see that thank you had to be a full sentence by itself. I adore your whole existence, even with your departure. Yes, you have blessed me with an aunt who is another mother to me, and she makes it her duty to show up for me and my children, as well as the family. With what little she has, then yes, I have my mom. But you know, we have been like Ike and Tina for so long that in your passing, we have been working hard to honor your prayers by healing and coming back to that mother and daughter space. Oh, and then that son of yours. I love my uncle. I will say more, but you know your child. Nana, I was asked to write a letter to my mother, and when I hear mom and mother, etc., all I think about is you. Your warmth, your love, your sharp wit, and razor sharp tongue. I think of all you've seen from racism to trying to make the right decisions and healing your family. I remember your stories, your voice, circles in my head. I remember your scent, your touch, and how your pure existence corrected the room and held the room with love. You wanted the best for everyone and made room for all. Even if you had none, you taught me about herbs and learning to be patient, listening how to regulate myself and not let someone dictate my being. You let me know when to fight and when to say nothing because silence is loud. I learned to hand sew as we watched General Hospital. Words can't express enough that a huge piece of my career is rooted in your love and in your mom's love. The way I teach my children and how I fuss at them, that's how I care for, and those I care for. It's in the same tone as you. Before you took your place in heaven, you told me, never forget that I am loved. You're proud of me and that you are thankful for me because I am one less person you had to worry about because my head was on straight. And whenever I get weary or my intuition feels shaky, I go to that place. So thank you for being my guide, my covenant, and love of my life. May you continue to have peace and turn heaven every which way but loose in your own way. Love, yours.
Thank you, Shamica. That was extremely powerful. As we carry the words and reflection we've just heard, let us gently shift from reflection into restoration. As we move into a guided meditation and grounding, led by Leyanne Oliveira.
Thank you, Shamica, for that. And thank you, Jameson. And of course, before we get into such an important topic of Black maternity, let's ground so we can fully receive the words of our sisters on the panel. So inviting us to connect first to our spine and our bum, whatever it's sitting on, just allowing our body to connect to what's holding us. And may we slowly bring our attention inward by closing our eyes or just fluttering them low, so you're just looking directly in front of you if closing your eyes is not fully comfortable. And begin to bring your awareness to your breath. Noticing where there's tension in the body that you can slowly release. If there's tension in your toes, your knees, your thighs, your stomach, and clenching your jaw, releasing your tongue. Noticing where in the body you might be holding any angst, any access of energy that you can soften and invite relaxation into. And of course, with mothers being at the center, I invite us to bring one hand to our hearts and the other to our wombs or to the lower part of our bellies. And I'm going to invite us to take 3 deep cleansing breaths together into our wombs, even for the male bodies, their lower belly, where the womb would be for them. Beginning our first cleansing breath in 3, 2, 1. Inhaling through the nose. Slow and deep, bringing that breath all the way down through the nose, down the throat, through the heart, and down to the womb. And then when you're filled up, hold. And then release slowly out through your mouth, releasing any angst, any tension in the body. And really letting out, fully exhale. And then when you're ready at your own pace, taking another deep inhale in, really inhaling all of the power, the memories that you have of the mothers around you, the power of the womb, bringing your spirit here, more present into this conversation to fully receive the magic of Black Maternal Week. Inhale. And then when you're full, hold at the top. And then at your own pace, exhale out through your mouth, anything that won't allow you to be fully here, heart open, womb open, to receive the powerful message, insights that we are about to receive. And then whenever you're ready, you could take the last deep breath, making it really intentional. Bringing in all of your spirit present in your body, inhaling all the way down to the lower belly, into the womb, allowing that energy to spiral there, to clear out, and then out through your mouth, release. Anything not allowing you to be fully here. And then slowly allow your breath to go back to its natural rhythm, remaining with the eyes closed. And noticing the two places where you have your hands. Noticing your touch first at your heart center. This place where we receive and give so much love. This sensitive place, this vortex where our mothers fill in so much of their love and care for us, where we hold so much of our mother's love, all of their sacrifices and endless care and nourishment. Just connecting to that love, the endless unconditional love from our mothers, all of the mothers, all the wombs that have brought us here. And then moving down, beginning to notice the womb space. The second hand, if it's the left or the right, that's placed right over the womb. Connecting there. And just filling up the space with gratitude for its power, the creative force that lays inside every woman's body, ready to create life, to bring forth life. And just filling both spaces up through your hands, imagining your hands filling up both of these spaces with the beautiful golden ray of light. And as you are transferring the light from your hands into your womb and in your heart, feeling the warmth of the light. And as the light fills you up, it's grounding your body. It's making more room for your spirit to be more here, present inside of you. And allowing both spaces, your heart and your womb, to be open to receiving the powerful insights and messages that we will receive from our powerful panelists. Giving thanks and slowly coming back while staying connected and open in both of those places. Slowly coming back and opening your eyes and staying connected to that space as we continue our beautiful time together.
As we come back together from this moment of stillness, grounded as a community, and with our minds centered and hearts open, we now move into a conversation with incredible birth workers who embody what it means to care for Black mothers with dignity, expertise, and love. Our first panelist, Jessica Mullings, a birth and postpartum doula, placenta encapsulation specialist at the Lotus Doula Group. Our next panelist, Lauríel Rivera-Stone, home birth midwife and founder of Awakening Traditions. Our third panelist, Sade Jean-Jacques, founder and lead doula at Earth's Natural Touch. So welcome, panelists. How's everybody doing? You can unmute yourselves.
Doing great. Doing great.
Good. Thank you for
Good.
spending time and making time to be here with us today. Tremendously appreciate it and excited to speak with you. So listen, we're going to jump right in, if that's okay with you all. All right. And I'm going to open this up to all the panelists. And Jessica, I'll start with you because you're first on my screen to my left.
All
And then
right.
Lauríel will work to you as well. And then Sade will end off with you with the first question. That's okay. All right. So to start us off, can each of you share what is joy in Black maternal health? Like, what does that mean to you, either in your work or in the families you serve?
Yeah, thanks so much, Jameson. And I just want to send love to all of my doula sisters on this call. First and foremost, it is always an honor to be in space, sharing this work, and being in community with each and every one of you. And also to be able to celebrate Black maternal health with each and every one of you today. Joy to me means safety for the families that I serve. Especially for the mothers that come to me with their concerns, their fears. Whenever I speak to people, initially, that's something that is a common theme. And every time we talk, like, I'm afraid. I hear these stories, and joy to me is at the end when
Mm,
they always say, "Thank you for listening to me. And you made me feel like I was heard, I was validated, my concerns
mm,
were real, and I feel so safe bringing you into this sacred space with me." So that's what joy means to me when I am
mm,
serving the families in my community.
mm. Thank you for sharing, Jessica. Thank you. Lauríel, what does joy mean in Black maternal health to you? How does that show up in your work or in while you're serving families?
Yes, thank you again, Jameson, for creating this space for us today. Um, Joy for me is a restoration of what's always truly belonged to us as melanated women and families. It's truly seeing families experience birth not as something to survive, but something to remember with
Mm,
reverence, have
yes.
good memories, feel empowered. Um, and the joy I get to witness is often really quiet with my families, but so deeply powerful. It's laughter during prenatal visits, it's confidence in the hands of the fathers and the partners, it's the way that the mother is able to soften when she realizes that she has options. Joy is its sovereignty, it's being informed, it's being able to say, I trust myself and I actually mean it. And it's for me as a midwife, joy in the birth space is witnessing my clients and my community feel safe in their bodies and being able to listen to their bodies. Joy is them not being rushed, not being dismissed or managed, but actually being witnessed and educated and cared for, and being at births where we have our hair wrapped and we're cooking fish stew and we have reggae playing, and like we're just having a really beautiful time. And it's so possible, and it's something that all of the mamas are deserving of experiencing.
Absolutely. Thank you for sharing, Lauríel.
Of course.
Sade, we'll end with you with this question. Joy, tell us, what does joy look like for you in this work?
First of all, I just loved what Jessica and L'Oreal had to share. I'm smiling here because I align with so much of what you already shared. And L'Oreal, I specifically appreciate how you talked about like joy in birth, not only as seeing birth as something to survive, but like how do we thrive in it specifically for Black women. And I think that's so important. So ditto. And also, I think joy for me also looks like agency, right? When people come in with a sense of understanding or even misunderstanding, but have the agency, over their own learning, over their own experiences, over the type of dynamic they want to see with either their partners or support people in the room. room. It's also when, because a lot of my clients are Black women, not only, but a lot of them are Black women. And it's really beautiful and joyful to see the ways that they bring in aspects of their cultures or traditions that are really important to them. Whether it's, they're Haitian and they want, that bath after, they give birth, whether it's like having someone bless the space, just all the different things that we hold on to that, or not even so some of the things that we hold on to, but some of the things that we're like now discovering about our own ancestral traditions and bringing that in. And I think Sis already said it, joy looks like safety, real safety, not just like safety from these oppressive, harmful systems. That's certainly part of it, but also safety in like one's own body and belief in that, like, I can do this, right? Even if this is my first child and I've never done it, I have a sureness in me that I can do this, that I was born for this, and that my people got me. So I love to thrive in lots of joy in the birth space.
I mean, thank y'all. I can't ask for a better way to start this panel off. That is, I'm experiencing joy just listening to y'all. And so thank you for getting us started off on the right foot. Let's keep that going. Okay, we're gonna talk about role and impact a little bit here. All right. So research has shown that like culturally congruent care improves the outcome for Black mothers, right? Representation, having somebody that looks like them, understands their culture. You mentioned music and things of that nature earlier. How does that shared identity or cultural understanding shape the care you provide, right? And if you can, maybe share a story or an example where your presence had a meaningful difference in the birthing experience. And so we're going to kind of work our way backwards this time, if we may. So, Ms. Sade, I'm going to start with you if that's okay.
Yeah, absolutely. I think that this is an important question. And I think that there are lots of ways that like having a cultural and emotional resonance with clients is so helpful because I think that birth and the experience of birthing is so sacred. And if you are in that space, whether as a doula, as a mother, as a partner, like you are there solely in service of that mother and that child or the children that are to be, born earthside. And I think that's a really important piece of it. So I think that like, having that shared understanding is important, whether or not it's my personal practice. I think having the space for, women, birthing parents to be in a space where they share something with their doula, and it's received as a gift, because I think anything that anyone shares in an intimate and vulnerable space is a gift. I want to receive and interact with it as such. And, I was thinking about clients that I've had in the past. And I had one client who it was really clear to me that she and her partner had such a beautiful and strong relationship. So in that space, my role as a doula is actually to get out of the way, right? And support their dynamic. And, think about all the ways that the partner can support the mom, because that's also a different experience for them. And I believe that either one of them was Jamaican or not. So there were things that we would talk about, which as a Haitian person, I would understand. And it was really nice because what happens in that dynamic is not only just like a transactional engagement, right? Like I'm here as your doula, I give you this information, you tell me what you want, right? It's really about like the shared storytelling, the shared cultural connections, and how we can just like be together as full people while
Oh,
also knowing and being clear that we're here for the mom and the child. Like
yeah.
that sort of point never gets lost.
I love
And it's something that I really appreciate, really, truly, and deeply, not only about like the clients I work with, but also as being parts of Earth's Natural Touch. I think part of what I experience with my clients is what I experienced through like my 14-month training and the sisterhood that we have together.
it. Thank you. Lauria, you sound like you're ready to go. I'm gonna pass it to you.
Oh, that was so potent and just like
Right? Wasn't
snaps
it?
for all of it. Yes, of course. It's familial. When I
Mm,
was in midwifery college, one of the things that we understood with what's happening with our sisters in the hospital setting specifically, again, because I'm primarily focused at home, is a part of the mistreatment of melanated women is because a lot of these doctors, they don't feel this familial connection. So the treatment is actually very different. And one of my first births as an independent home birth midwife, my client called, she was laboring so quickly, but she called me and I didn't have time to like get my scrubs on, get all dressed up. So I ran out my house, my hair was wrapped up. I had, I just looked it looked like I was at home, right? And then I get, and the doula rushed there and she had her bonnet on, and I'm like, sis.
Mm.
And we see the mom, and she's there with her mother, and there's a grandmother, and there's this communal and familial essence that is not necessarily offered or duplicated in more conventional settings that I've experienced, or with non-melanated doctors. And it was such an aha moment for me, where I'm not saying that what they do is right, but I got to experience of, oh, this is what makes it different for the doctors in the hospital. This is what they're feeling.
Yeah.
And for me, it felt like such a blessing to be able to share that space, educate the mom throughout our prenatal phase, right? So she felt so safe, and all of us just feel this familial connection. And she has her baby and welcomes her baby, and the doula's crying, grandma's crying on my shoulder, her son is in my lap, and I'm crying, and we're having a great time. I just had a birth with Sister Leyanne, and the second baby comes, she's bawling her eyes out, and it's just so familial. There's this sense of connection and this village mentality that is innately, honestly, it's innately a part of who we are as a people, and it's incredibly important. And it's such an honor to be in this space with mamas and tap into that.
Thank you for sharing. Sister Jessica, I'm gonna pass it to you to bring us home.
Yeah, much like Sade and Lauríel have said, like these are, it's like when you get in a space and you see the other Black person and you both go like this to each other. It's like that feeling that you get when there is a ancestral like honing in with one another, where you're like, I get you, you get me. How are we going to look out for each other in this moment? I'm happy to see you. It's that silent communication. As a queer doula, who gets the privilege and honor of serving queer mothers in our community, I'm able to sit with same sex couples, or a lot of times solo parents who are opting to do this on their own. And I get to sit in with them as their partner, which is such a gift of seeing them be nurtured in the ways that they desire, sitting with them, listening to them, going to their prenatal appointments, and not only being a listening ear, but also, when the doctor steps out the room, we kind of look at each other and we say, how did you feel about that? Or, where do you want to go next? Do you want me to be involved in this conversation, or do you feel like you have it? So teaching them advocacy, that your own autonomy is yours. If you are not getting the level of care that you desire, we can switch practices. So many times, I'm sure a lot of us have experienced like, hey, I go to this OB because my mom went there, or I've been going since I was 16, but I'm not comfortable with the level of care that I'm receiving. Having someone that looks like you give you the green light and assure you you can get the level of care that you deserve, and I'm going to help walk you through that, means the world to so many of us. And being able to give that gift to people that look like us,
Yes.
it's undescribable. It's
Absolutely.
like that we get to share, and like Sade said, and like Lauríel has said, it's sacred. We are ushering in life together. We are starting something new together, and we don't leave them at the end of that. Our lasting effect is with them forever. I have clients who I run into at dinner, and they tell their
Yeah.
kids like, she brought you into this world. I said, no, no, not me. And they're like, no, you did that. You were here. And when I tell you, it's so impactful. And I know all of us have experienced that. And so cultural competency is
Yeah.
so much of, I don't want to say it's everything, but it's the globe.
Yes.
It's the globe
Yes.
that surrounds us in love and care.
Yes.
And it's so positively impactful for us. Most clients tell me, they'll say, oh, I Googled Black doula near me because I want a Black doula, not
Mm-hmm.
because they just want doula work. They want someone that looks like them and understands not only the system, but understands culturally what they could experience and make it beautiful for them.
Thank you for sharing. With that, I will say, for those who are watching that are looking for a Black doula, you can go down to the comment section and you can click a link in there that'll get you all the information to our amazing panelists, as well as the individuals who are helping us out throughout this webinar. So thank you for sharing that. We'll move forward with our next question, which we'll talk about and identify and acknowledge disparities, right? We know that Black women in the United States, unfortunately, are over 3 times more likely to die from pregnancy-related causes, and that many of these deaths are preventable. Okay? From your perspective, what are the biggest gaps in the system contributing to these outcomes? And I would like to do is direct this question to maybe two of you, and then I have a follow-up question that I will leave for whoever's left over. Is there anybody dying to jump in on this question? Jessica? Oh, they all. Well, how about let's do this? All three of you take a little bit of time. That's okay. All three of you take some time. Jessica, you put your hand up first, so we'll start with you.
Yeah, thank you all for sharing with me because I think that this is we've experienced these disparities. So it's one thing to read them and to see them on a PowerPoint presentation or scrolling through Instagram. When you are in these rooms and you are experiencing these microaggressions and racism and these disparities in person, it's heartbreaking. It's heartbreaking, and it really pushes you to advocate for your clients. Being that I work with a lot of clients that use the same health institution, I get to know a lot of these OBGYNs and midwives, and I see the disparities in how my Black client and my white client might get totally different levels of care from people that I see on a regular basis. I've had to call these people out on that. You don't usually behave this way, or why would you recommend this or that? One of the things that I personally experience often is that they just don't believe Black mothers. Pain levels, it's one of those things where someone might say, I might be experiencing something that is making me uncomfortable because I know my body, I am connected to it, and it's brushed off. Or there might be a medication that someone might say, hey, this is something that I've researched and I want access to. And the medical institution might respond with, we'll get that for you. And 3-4 months later, we still haven't had access to that. So the accessibility there. I've had to advocate for clients who actually have allergies to certain medications, and they're being offered these medications while in labor and birth. I've had to literally fly in those moments and say, aren't you allergic to this or that? And they're literally about to, administer these things to my clients. Um, there's such a disparity that stems from, obviously the systematic racism that now has infiltrated, the medical institution, and now that has blossomed into folks with, medical misinformation. So a lot of our clients that are in these institutions experience that pretty often, and it's sad, and it's really sad. It's angering, it's frustrating. I have come back from births and said that was beautiful, but here are the things that I don't even know my client noticed. I saw these microaggressions. I saw them have the entire, classroom come into my client's, room without consent, or offering things that they didn't want or that we didn't agree to, or didn't give them the full scope of like what the full procedure would be, or not explaining things and rushing through them. Hey, we're going to do this thing. Don't worry about it. And not giving moments of processing, or here's what the side effects could be to that. I see all of us nodding. Yes. It's a never ending list that I'm sure my two sisters are going to address, but that's what I wanted to start with.
Thank you for sharing, Sister Jessica. Sade, we're gonna pass it to you. Lauríel was nice enough to be willing to jump on the next question, so we'll have you jump into this question, if that's okay.
Absolutely. And I want to preface this by saying, like, part of the reason why I was so eager to respond to this question is because I've been reading Valerie Carr's book, See No Stranger, and it's really like helping me to sort of like reframe things and like tap into things that like I've been feeling, and she has such beautiful language to talk about it. So when I think about like the gap in the system that exists specifically in the birth space, I think about like a lack of love and a lack of wonder. And I think a lot of times what happens in these spaces, especially for Black women that come in with some degree of understanding of an expectation that I'm going to be met with like this amount of pushback or whatever, I think that institutions, doctors, nurses struggle when institutional power is confronted with personal power, and that personal sense of power and agency is perceived as strange. And instead of being met with wonder, like, okay, I wonder what kind of experience they had for themselves. I wonder, how they're feeling about, being here in this space. They're met with a curiosity that's like, what's wrong with you that you're not listening to me, the expert on your body and your experience, that you would even come in like that? So I think when you're engaging in a power struggle, from a space of like a lack of love and wonder, you are, Black women are further and further pushed to the margins, further, they're more deeply othered. And the more deeper that you're othered, the less human you seem, right? The less human you are, and the less humane your experience. So when and the reason why I wanted to frame it that way is because I think sometimes like we get lost in the jargon of like racism and bias, and all of those things are absolutely true, right? We know how deeply embedded and I would say foundational racism and other, systems of oppression are to all institutions, including and especially the medical institution. But when we think about a lack of love, that forces, I hope it forces people to think about like, I'm actually engaging with people here. I am engaging with children here, right? And because I love children and I love mothers and I love people, this is how I, in my practice and my, and what I do, want to support you because I love you and you are a part of me that I do not know yet. And that's how Valerie Carr frames, the concept of wonder, especially when there's such like vast differences between people experiences. That was kind of a slip, but it happens, right? I said experiments, but that's part of it that shows up in the hospital. So when you got people rolling in iPads to force people, judges, to decide that women are going to have C-sections, that's because of a lack of love and a lack of wonder to have the audacity to interrupt a woman's sacred space when it is not emergent to decide for them by a panel of white people that do not know you, do not care for you, to say you need a C-section because you are not in your right mind to make that decision for yourself. That's a gross lack of love. And I think that when we embody love, we also embody empathy, right? If we don't embody love, we cannot have empathy to understand how scary and how disrespectful something like that is. And I think that's where the gaps come into play because we are not talking about humans interacting with humans. Technically and literally, we are, but ideologically, we actually are not.
Whew, a lot to unpack there. Thank you for sharing. Absolutely. Lauríel, despite these challenges, and they are real, there is still so much strength and healing in Black birth spaces. So what are some of the ways you intentionally create environments for joy, safety, and empowerment for Black mothers?
I'm still just taking in the energy,
I understand. I understand. Trust me.
It's so potent. For me, my clients and the community that I get to serve, the one thing that is easy to observe is the lack of education. We are not truly educating our sisters, like, period. We're not educating them on how their bodies work, how our bodies work throughout pregnancy, throughout birth, in the immediate postpartum, which are in the birth and the immediate postpartum, statistically are the most dangerous times, right, for us. A lot of people are going through this experience and they have no idea what's happening. And we don't understand what's happening within your body. You can't actually like advocate for it, especially when you're working in a hospital system that does not care. Much of what Sade was saying, there's a lack of love. And so the lack of education, it's compounded by dismissal and bias in clinical spaces specifically, where melanated women are consistently not listened to, right? Their pain is minimized, their concerns are delayed, and those delays actually literally become deadly. And on top of that, we're operating in a system that prioritizes intervention over prevention, where we're kind of like waiting for complications to pop up and show up instead of supporting the body through nutrition, stress management, love, touch, baths, herbs, community care, continuity of care. And even though the evidence is clear, access specifically to midwifery-led prenatal support, even if you're not choosing me to have a home birth, right? Having the education through a midwife or even doulas who are educated under midwives is incredibly important. It's so important. It's culturally aligned care, and it's not limited. There's so much for us to know, and it's rare for my clients to actually go into the hospital. It's extremely rare for the families that I work with to step into the hospital and be completely taken advantage of. And that's because I center the discussion around education over authority. And my clients are active participants in their care, not passive recipients. And so we get to have an unrushed relational care because time and presence is actually what allows a woman's nervous system to settle, which deeply impacts her laboring experience. And that changes the outcomes. We get to integrate ancestral wellness, cultural remembrance. Again, like I was saying, through herbs, I have a lovely apothecary that all of my clients get to take a part in. And we get to name wisdom that actually like already lives within us. And for me, this work that we're doing and the movement that we're doing, like, look at all these sisters here. They're so intelligent, right? Like everybody is so incredible and so passionate about this work. And what we're doing is restoring what's actually just missing. So we don't just survive and make it through, but we're actually feeling safe and seen. And to me, the priority is truly, truly, truly educating one another. Yeah.
Thank you. Thank you all for sharing. So there's a final question that I want to ask, and I don't want us to rush through it. So I'm going to do a little improvising if that's okay with y'all. We have two amazing representatives with us, and they've taken time out of their day during session to spend time with us. And I would love to, if it's okay with you all, bring them in. We'll hear a legislative reflection from them. And then I want to invite you all back to the panel to get this last question answered, if that's okay with you all. Is that all right? Great. Thank you for working with me. So we'll do that. And I would like to take time to welcome Representative Trenee McGee, who is proudly serving West Haven, and Representative Belton, Kai Belton, who's proudly representing Middletown, who both serve as co-chairs of the Black Maternal Health and Infant Care Caucus. Thank you for making time with us. And we just wanted to give you space to speak and reflect legislatively about what Black maternal health means to you and what are some of the policy and things that potentially you're working on to support this week in Black mothers. So thank you for making time.
Of course.
Representative Belton, I will start with you if that's okay.
Yeah, that's fine. Thank you for the invite. I appreciate all of this beautiful energy in this space. So thank you all for that. And I want to thank the commission. I'm going to try to say this, Commission on Women, Children, Seniors, Equity, and Opportunity. Did I say it right?
Yes, you
Okay.
did. You did that. Absolutely.
So I always mess it up, but I really appreciate all the work that you all do. And I thank you for the opportunity for, being able to share this message in recognition of Black Maternal Health Week. I'm really excited about the attention this week is getting. It's like every year, I'm seeing so much happening in my community, throughout the state, and throughout the country. And what that tells me is that more people are being educated and aware about Black maternal health, and that just makes my heart smile. And we know that this isn't just about awareness, it's truly a call, an opportunity for us to learn more, for us to do more, to honor our lived experiences, stories, and, for those of us doing the work, to recommit and do better, better for Black mothers, for Black families, and better for our communities. And I just want to take a moment and acknowledge the doulas, to acknowledge the midwives. My daughter is a doula, and I'm very proud of her. And she supported my daughter-in-law and my son in delivering my 8-month-old granddaughter, and it was a beautiful experience. So I really wanted to take the time to acknowledge the doulas, midwives, healers, advocates, because I know the work that you all are doing. So I thank you. And this work is important. It's truly essential. You know, you all are showing up in moments of vulnerability and transition and helping to shape lives. So I really appreciate that. And I'm saying thank you, and I'm saying thank you on also on the behalf of the state of Connecticut. So I'm a mom, I'm a social worker, I'm a legislator. I see every single day how systems are impacting people's lives, especially the healthcare system, and especially when it comes to Black lives. And we know here in Connecticut that Connecticut is considered one of the safest places to give birth unless you are Black. I say that to as many people as I possibly can, and you all know that, but I say that in all spaces because I kind of want people to feel uncomfortable when I say that because it's important to hear. And it's a fact, and it's a heavy one. It's something that lives with me. It's something that I carry. It drives my work. Um, I really am always thinking about how we can change outcomes, how we can have better outcomes. And then I think about it and I try to change the language better to best outcomes because we truly deserve the best outcomes, not just better. And we deserve that right now. And I feel like we're worthy of that. And I'm really proud to be the chair of the Black Maternal and Infant Health Caucus, and proud to have Rep. McGee as our vice chair. And we've been doing some really great work, advancing legislation that is truly grounded in equity and care. We've done things that expand access to birthing options. We've done work to support doulas, to strengthen the doula workforce, work that really improves care and delivery, and also doing work around perinatal mental health, which is essential. And I think we are intentional about making our system safer and equitable for Black families, which in turn makes it better for all families. And really also trying to focus on transparency and accountability when it comes to hospitals and birthing centers. And yet, we still have so much to do. We talk about this all the time. We are uh, going to be visiting York and really trying to do some work around incarcerated women who are giving birth. And I think we'll be focusing more on that next legislative session. Um, so we know that there's so much more work to do in many different areas, and we're committed to doing that work. And as I was listening earlier and listening today, I'm happy to be invited to this space as a legislator, but I'm also a social worker and healing artist that really centers women's wellness in my private work. So this event really stood out to me because I was hearing things like celebration and joy. And we don't always get to hear those words when it comes to Black maternal health. And I think it's important that we do hold on to that. I think we must hold joy, right? And we must hold healing, um, and space for breath, space for restoration, space to regulate our nervous systems, and not just the moms who are going through the journey, but for those who are doing the work as well. And I think our ancestors understood this. Like they carry the wisdom, they carry the care, they carry the joy around birth, healing, and community. And we must return to that. And I can see the shift of us returning to that. And it's a beautiful thing to watch. Um, so I'm going to end and I'm going to let Rep Trenee go. But I just want to say, as a mother, provider, advocate, legislator, I think it's important for all of us to remember that we deserve to be safe. We deserve to be heard. We deserve to be cared for with dignity, with compassion, and respect. And we deserve this always. So I thank you all for your time today. And I thank you for all the beautiful work that you're doing.
Thank you, Representative Belton. Thank you for making time. Vice Chair Representative McGee.
Thank you, Jameson, and thank you, Rep Belton. That was so awesome, and truly an honor to kind of piggyback off of that. And thank you to the Commissioner, Melvette Hill, for just always create. This is the second or third conversation that I've either been a part of or experienced, and you're doing trailblazing work that is needed. I think, if we didn't have you in this space to do the work that you're doing, it wouldn't be done. And so I just really appreciate all that you're doing. So my name is Representative Trenee McGee. I represent the 116th, which is West Haven. And I have the honor of being the vice chair of the Black Maternal Health and Infant Mortality Caucus. And in my profession, I'm a theater teacher. I teach integrative arts. My background is in the arts, and we do a lot of arts integration, therapeutic arts, and taking theater pedagogy and implementing it in the lives of children to help them understand their emotions. So we do a lot of mood meter work. So as Rep Belton said, breathing work, all of those kinesthetic responses are so important. And it brings me back to vocal and diction class. So as I said, my name is Representative McGee. And, if I just want to just briefly share that I'm really proud of the evolution that I've seen take place around Black maternal health in the Capitol. When I was elected in 2021, it was not really talked about. And then in 22, we start talking about a little bit. And then in 2023, you had legislator women that are like sharing their own traumatic birthing experiences. And then 2024, we started to really create policy around it. And so, am I still here? Can you still hear me? Okay. And so the evolution of small conversations actually becoming policy that has been implemented, while it sounds amazing and we've achieved it, it can also be scarce, right? Like that doesn't always happen. Like conversations don't always become actual legislation that is tangible, that impacts the lives of the people that we represent, and especially Black women. One of the things that a legislator used to say before me is that a lot of times people who are closest to the problem are furthest from the power, and then obviously even further away from creating a solution. So to be a part of this dynamic space where we are championing the health of women, the maternal health of Black women, is not only trailblazing, but it is, to me, a reflective sort of work. So as a woman who is sitting at the table to understand the dynamic and the dichotomy around women's health, it is also helping me to chart a path for my own birthing future. And so I thank you for the work that you all are collectively doing. And if I could just share this really briefly, I was talking to my grandmother, and she is the oldest of 5 children. And she was just sharing the joys of her mother giving birth in homes. And we talked about the importance of home births and what that meant for Black women, and that being at one point the only option. But when births were taking place in homes, we saw less mortality. And so we talked about the beautiful birthing section that's in the Blacksonian Museum. And you have all of these incredible midwives, all the, brilliant midwifery work, but the dynamic of what made them trailblazing catalysts in their spaces with that was that they understood the cultural bounds of what Black women experience in such a high, potent racist time. And so while we look at the statistics then and we think, okay, we have modern medicine, we have hospitals, we have all these different facilities that should be able to equip us, we see drastic numbers of mortality impact women today than they did back in a time where they didn't have the resources we have today. So that tells us, like Brett Belton said, in some ways we have to go back to the holistic basics, which is vitally important. That is prioritizing education of doulas, that is prioritizing a certification that is not binding or financially limiting, that is prioritizing the efforts of Black women in our community. And also, obviously, it's prioritizing the health of those who aren't even here yet. So I'm really grateful to just be at the table and be ingrained in these conversations. And I thank you all so much for the work that you are doing, frontline work. Like you are, do we always say like doulas are literally like at the cusp of what can be life or death. And a lot of times the brilliance and the compassion and the understanding of doula work is really what helps to sustain women throughout their birthing experiences. So thank you all for having me. I'm excited to continue doing this work. And thank you to the Commission on Women, Children, Senior Equity and Opportunity. I only said it right because it's behind Jameson and Melvette. I'm not even gonna lie. That's the only reason I said it right. It's so long. But thank you all so very much.
Oh, wow. I just want to take a second to acknowledge and thank both Rep. Belton and Rep. McGee. We are in session, a shortened session at that. And
Jameson,
so,
can I just say this
yeah,
really quickly? Because I think it's so
please.
important to give Black women their flowers. Rep. Belton
Yeah.
has done a lot of exceptional work around Black maternal health. As there were conversations that's taken place, she's really been a forerunner in taking it and bringing it across the finish line. She didn't mention this, but she is the vice chair of public health, and I just felt that was so important to mention. Because I don't know if there's ever been any Black individuals who have led public health in a leadership type of way, and if there have been, I'm sorry. I just am serving right now with Rep. Belton, and so she's really done a lot of great maternal health work around that and really stuck to it. And that's why we see these policies. When you see somebody running, sometimes we, especially as Black women, we have to link up with them to really get things across the finish line. So I just wanted to just shout her out publicly because I think that's important. So thank you.
No, thank you for doing that.
I appreciate
Absolutely, greatly
you.
appreciate that. So, as I was saying, I just wanted to acknowledge both Rep. Belton and Rep. McGee. We're in a shortened session. Things are busy. Committee meetings are happening, and they took time out of their day to, spend with us to really show just how meaningful it is. And so I just wanted to take a second to acknowledge that. So thank you both. I do want to bring back that panel because we do have a final question that I want to share with you all. And then after that, we'll jump to our spoken word. So I'm going to bring back my team. Start with Sade and Sister Jessica and Sister Lauríel. Here we go. Okay. So, we've heard today about the lived experiences of care practices that are making a difference on the ground. At the same time, and this is almost kind of perfect right after, having the representatives with us, that Connecticut has taken important policy steps through maternal mortality review efforts, expanded postpartum Medicaid coverage, legislation supporting doulas, birth centers, and equity in care, such as House Bill 5561. There's also a current bill working their way through legislation, including SB 91, which, if passed, would create protected areas at hospitals, doctor offices, and health clinics designed to keep these spaces safe for all mothers, including Black immigrant mothers. As we think about aligning community wisdom with policy action, I'd like to close with this final question. Considering the progress that we've made in the state of Connecticut through legislative efforts, some that was spoken earlier, Where do we go from here? What is legislative solutions or policy changes that are needed to support Black maternal health in the state of Connecticut? We're going to start this off with Lauríel, if you may.
There's so much.
Yeah.
As a home birth midwife, there's a lot of discussions that we're having with the committee and the Department of Public Health. But as it pertains to this, the thing that I have to say honestly is we really have to start including the doulas in the conversations. There are a lot of people who are interested in having these bills, and it's like the colonization of this craft and this art that we are the experts in, and it doesn't feel okay to me, if I'm being honest. We have to start, y'all really need to start having conversations with the doulas, the midwives, the birth workers who are in the homes of these mamas, who are supporting these families, who see the gaps, who witness all of it. And then also holding the doctors accountable for the harm that they are creating. There are other states where certain obstetricians and gynecologists are like wanting to ban doulas. And it's because they know what they're doing. They know exactly, these doulas, they are so incredible. They know what they're doing, and they know how to keep our sisters alive. And so if you want to create real change, oh, my earbuds, can you hear me?
Yeah, we can hear you.
Okay.
I apologize in advance. My earbuds died, but I apologize. I'm babysitting two birds, so they're very chatty. I don't know if you can hear them. But just having the doulas involved. And if you really want to make a change, please listen to them. I would happily sit in on having the conversations on how we can get better education for literally everyone, including the doulas. There's a lot that they really can do and are doing, but they need your help. And if you're bypassing them and solely listening to what the doctor's saying and what the hospitals have to say and their procedures and their protocols, you're completely, it's like we've lost the plot. So really calling in the doulas into the space is going to be like the number one thing that we need to do here in Connecticut, and really listening to them.
Thank you for sharing. Jessica?
I have to apologize for my reaction. I almost fell out my chair, Lauríel, because I said, yep, that's exactly what I wanted to say. Include us in the conversation. I say that in all caps and in bold font. So many times we are just being included on what these conversations are after the fact. And sometimes they're not as beneficial for us or for the communities that we serve. So just to mirror the same things, that's what's key and important. Funding is always at the top of my list. People sometimes are scared to say it. No, pay us what we deserve. Pay us for the education, the care, the knowledge that we provide, the safety, and also the support to doctors. We want to work with them. We want to work with the midwives. Most of us want to, if not all of us, we are there to be in community with the other care members and don't want to pose as someone that is a negative in the room. We want to work together, and we want the doctors, the nurses, everyone on staff to embrace us in that way so that we can all work as a team to better serve our clients. So that's Lauríel, you hit it right on the head for me, and so I just wanted to ditto piggyback on that.
Mr. Sade, we were closed with you.
I definitely agree with both, Jessica and Lauríel, all the things that you shared. And I want us to remember that Black maternal mortality is a symptom of medical racism. And the reason why I restate that is because I think a lot of times when people are talking about this work, it's as if Black maternal mortality just like blossomed on its own, right? It's something innate about Black women. there is nothing inherently wrong with us that lead to our own demise. And I think until we talk about Black maternal mortality as a symptom of like medical racism and the institution of medicine in general, then there's only so far, we can go. I do think that like certainly paying doulas is important, certainly making sure that like, we have things like Black Maternal, Health Week and different things like that. It's absolutely important. And it cannot stand alone separate from the institution that's actually causing this harm. So with that said, I think that we absolutely need like deep partnership with Black moms, partnership with the doulas that have a track record of doing this work. And I say this as like no shade, but I think when things become bigger and there's an opportunity for like more visible engagement, people start coming out the woodwork for various reasons. And I think sometimes what gets in the way are the people that come out the woodwork, who are interested in like having that visibility, right? We can't ignore that ego-centered work happens in all industry, right? I think it comes up here too. So I think, in these spaces where there are opportunities to make decisions about Black doulas, our work, our clients, we need to include those people that have been doing this work, and people that are interested in doing this work for Black women and Black children. And I think that's an important distinction. It's not about self, it's about who we are in service to. And I'll stop there.
Thank you. Oh, yes. Final word, Lauríel.
I
Back
just
to you.
wanted to add to that. It's so good, and I'm sure we could just like have this. It's obviously so passionate about this. Right. But another thing that I think is incredibly important is, as legislators, questioning the protocols and the policies that actually exist within these hospitals. Asking why. It's important to ask why. There are there's a myriad of hospital births that I have supported as a midwife, where my client is attempting to advocate for themselves, rightfully so, where the hospital legal team then has to get involved. Because there's a lot of nurses and doctors will have like their own liabilities, if you will, and will say no or yes, or come up with these rules that aren't actually written into hospital law and or policy. And it's deeply impacting how my sisters, the women in my community, are able to bring their babies here safely, or have the births that they actually desire. And we think of these policies specifically of who is it actually benefiting. And because a lot of the harm that we're seeing, they can say it's a policy, they can say it's a standard, but it's not actually benefiting our women and our sisters. And that there needs to be like a whole review of all of the hospitals in this state, and the why, as to why these policies exist, and the protocols exist as well.
Thank you. Thank you all for sharing. Thank you for being such a powerful, and I do mean powerful, panel. So thank you kindly. We are going to make a transition. So building on this rich conversation and carrying forward the wisdom of our panel, we now want to bridge and transition back into a space of reflection, back into a space where we can enjoy creativity. And so with that, I will welcome Brittany Needham, who's a doula, to share spoken word with us. Thank you, Brittany.
Yes, thank you, everyone. So the name of this poem is called Instilled. This one goes out to all the mamas. The mamas, baby mamas, the ones that love a little drama. The ones, this goes out to the ones who travel here from another country for commas, searching for a better future, something that would suit her with a piece of peace, maybe a slab of grease of something to make this thing we call life much smoother, working, hustling. This one goes out to the sisters from other misters who covered us and mothered us when mama was too busy, crying behind closed doors, kneeling and praying, reaching floors that we dare not speak of. This one goes out to the mamas healing from trauma, the grandmamas, the ones who may have raised us and raised us with some tough love, good food, and wisdom. Their words ringing like prisms as we try to make sense of the various voices that guide our choices. It all unfolds, and I understand that the pressure that the pressure this world put on you is going to take way more than two hands to hold the weight of what you carry. Even in a world so scary, you do not fold. You continue to mold us, hold us, and told us that everything was going to be okay. Dear Mama, if only I knew that it wasn't always going to be that way. This one goes out to all the mamas who stood their ground when it felt like everything was turning upside down, who rarely showed a frown, who is a vessel that God continues to pour down into and cultivate. Mama, did you know that your womb could create such a powerful being? It's got to be freeing knowing that your creation is stationed for greatness. All that praying and kneeling should give you a feeling of safety, that peace and faith be, that your baby will be straight. For the plan that God has ordained, Mama, those sacrifices strictly made for your children to gain do not go unnoticed. I'm saying thank you. We are saying thank you because what you have instilled becomes revealed in those darkest moments when I question loyalty. I remember I am royalty. The blood we share, it is only fair that you know now it is your turn to be poured into. So this one goes out to you, mamas. Thank you.
Whew, thank you. Thank you, Brittany. Are you kidding? I understand why it's award winning now. Thank you very much. Whew. All right. I'm gonna let that sink in just for a quick second, y'all. Just for a quick second, let that sink in. That was powerful. Thank you, Brittany. Thank you kindly.
I'm sorry, can I just disrupt the silence? Girl, yes.
Okay.
Just yes. Okay, just
Thank
casually
you.
muted herself back.
Right.
Come back here. Come back here.
I
Loved
had to
it.
take a quick breath. I was like, whoo, let me get myself together
Ooh,
because
you
it's
was in
just,
your bag.
yes,
I
yeah.
love
As
it.
I get gaining all this, all that you've talked about and that passion, then as I start going through this, I'm like, I'm just charged up and passionate. So, yes, thank you all so much for just creating that space of joy and safety for me to be able to, one, invite me in, but for me to be able to share this poem. Thank you.
Thank you, Brittany. Greatly
Mhm.
appreciate that. We are going to shift now with resources. Before we do that, I'm going to pass it to Melvette. Let me just.
Well, while you're getting the
Move.
slide, I just want to share. This has been a remarkable experience, right? So we had a panel, we had centering, we had spoken word and letters of love and joy and honoring. And as we get ready to close out, I just want to acknowledge that while we have made gains, and we're so glad that our legislators came on and really talked about some of that work, we do have some great legislative champions. There's still work that needs to be done. And so we invite our legislators to consider exploring, expanding, and diversifying the prenatal workforce. We need more of you, not just Black doulas and doulas of color, but we need more of us in different roles that engage families. We need to be addressing implicit bias in healthcare and accountability. We need to be investing in community-based care models, right? So more funding to your centers, more funding to birthing centers, more funding to the people who are on the ground, who are closest to the people we're trying to serve. And also, we need to consider addressing the social determinants of health as it relates to um, families. We need more funding and access to housing. We have to bring babies home somewhere. We have to have moms and babies in safe spaces, in clean spaces, and housing that is affordable. We need nutrition and we need services that are wrap around for not just mom and not just baby, for the rest of the family. We need to consider environmental justice in this whole conversation around social determinants of health. And then also, most importantly, Black maternal mental health. And so finally, what I would like to do is thank all you doulas here today, all of you who have your sleeves rolled up, who are on your knees praying, and who are doing the hard work. We thank you for that sacred work of caring for and protecting the lives of these mothers and for ushering in new life, the sacred work of doing that, ushering in new life for future generations. So thank you for giving me time and space to close with those words today. And Jameson, why don't you take us through some of the resources that are available?
Thank you, Commissioner Hill. I will do just that. And then we'll start off with the Black Mamas Matter Alliance. As you can see here on the screen, this is the organization that is honoring and putting together Black Maternal Health Week. And so we wanted to take the time to uplift them. Feel free to visit their website, blackmaternalhealthweek.com, to learn more about the resources that they offer at a national level. Locally and within the state of Connecticut, I want to highlight a few resources. We'll start with Fairfield County's Community Foundation. They have the Black Maternal Health Initiative, which is a collaborative effort designed to address stark maternal health disparities in Fairfield County. Aims to improve health outcomes for Black mothers and babies by enhancing the birthing experience so they can have the best opportunity for a joyful birth. We also want to highlight Connecticut Health Foundation, which has a maternal health equity, a blueprint for Connecticut. Their vision is to have a 50% reduction in the burden of severe maternal morbidity among Black women over the next 3 years. So from 2026 to 2029. Lucinda's House. Lucinda's House was created in 2022 by Lucinda Canty, Dr. Lucinda Canty, to address the racial disparities in maternal mortality and severe maternal morbidity. Lucinda's House exists to create environments where mothers of color feel safe and supported and can actively participate in eliminating structural barriers to improve their overall health and well-being. Mind Blossom. Mind Blossom focuses on the mental health side and postpartum. And last but not least, Husky Maternal Bundle. Husky Maternal Bundle talks about doula integration. The Connecticut Department of Social Services plans to incorporate access to doula services as a core feature of the upcoming Husky Health Maternal Bundle payment program. The goal for the additional high-value services is to bridge the equity gaps in maternity care for historically marginalized birthing people. So info, when it comes to Medicaid info, I want to send folks to the Connecticut Department of Social Services to gain more information there. Resources are also the doulas that you saw today, from beginning to end, top to bottom. So I want to take a second and lead this page up. We have Shamica Frasier from New Birth Journey, Lauríel Rivera-Stone from Awakening Traditions, Sister Jessica Mullings from the Lotus Doula Group, Leyanne Oliveira from Life with Lo. Want to shout out Doula Shah, who wanted to be here, but unfortunately was under the weather, from Golden Radiance Village. Brittany Needham, who is representing Doula Shah from Golden Radiance Village. And Miss Sade Jacques from Earth Natural Touch. Acknowledgments. Have to acknowledge Brandon Hutchison, a postpartum doula who helped me gather this amazing group of doulas that you had the opportunity to hear from today, as well as Amelia Sherwood, founder of Sankofa Learning Center in New Haven, Connecticut. I do also want to take time to thank my team and my commissioner, Melvette Hill, and the rest of the team from the Commission on Women, Children, Seniors, Equity, and Opportunity. As we close, we honor everything that has been shared and everyone who has made this space possible. We extend our deepest gratitude to Director Melvette Hill and the team for their unwavering support and commitment to elevating such an important and timely conversation. May the legacy of today's discussion continue to shape how we care for one another, advocate for justice, and build healthier futures for all. Thank you. Thank you, thank you, thank you for being here. And we will see you next year in person at the Capitol. With that, we thank everybody for spending time with us.